Hello and welcome to the Extraordinary Health Podcast. And today I'm going to be going over our holistic health assessment for reversing neuropathy. I guess I want to even take it even a step back a little bit further than that here today because, some people are just not even sure, do they have neuropathy? Now there's, more and more places where you can maybe find some alternatives to current medical treatment. But in our office, we have over a decade of experience successfully reversing neuropathy symptoms in patients by at least 60 to 100% for many individuals. I would say it's in the high 90% range. So what we've had just recently set up here is an in-office workshop. So if you don't know if you have neuropathy or you have questions about neuropathy, you can contact the office. Most of them are at 1 p.m. on Tuesdays, and you can come in and get your questions answered, get a little bit more information on, just how we even assess and determine if you have neuropathy. If you do have neuropathy, with our assessments there, and I'll get into that in a little bit here, we can let you know how severe it is, probably what it's going to take to get treated, and just what kind of costs it might be for the treatment that is going to be needed to help reverse your neuropathy. Also, if there is possibly any kind of insurance coverage for it. So, showing up for a workshop, you're going to sit down and, get a better understanding of what neuropathy is. You're also going to get a better understanding of just the procedures that will be done in our office. We do a quantitative sensory testing as well as some motor testing as far as muscle strength. We want to find out what you can feel, what you don't feel, and then even how well are your muscles and joints working, especially in the areas where there might be neuropathy. If we find that you do have some sensory loss and are a candidate for care, we're still going to need to find out exactly what is causing your neuropathy. We also have tests that we do in office to determine if you're low in nitric oxide. What is nitric oxide? Nitric oxide is a chemical in the body that helps to improve blood flow. And that is the main issue with neuropathy here, is that you're losing blood flow to the peripheral nerves, especially in the hands and the feet. And as that blood flow diminishes, the nerves start to die. That's where a lot of people then start to have numbness and tingling. They could have burning sensations. They can feel like their hands or feet are cold. I've had patients describe their hands and feet as feeling like hamburger. A lot of times then that starts to affect your quality of life. And, people will have a hard time sleeping at night. They'll have restless leg syndrome. They can't even stand to have the pressure of sheets just touching their feet. So their feet are hanging out the end of the bed, or they got to tent the sheets at the end of their bed. They can't even get up out of bed very easily, or even up and out of a chair, because they've lost so much sensation, especially in their feet, that they have to walk with a wider stance. They have to start using a cane or a walker, or once it starts to even get really bad, that's where you're going to end up in a wheelchair. So, we've helped people reverse that and literally go from that wheelchair back to a walker, back to a cane, back to even walking again. So it's not impossible, but we do need to assess you just to determine how severely you're affected. And sometimes, yes, there are patients that are so significantly affected that we are not going to be able to help you. If that's the case, we'll make sure that we get you referred to, a place where you need to go to get some treatment. But, most of the patients that do show up in our office, they've already been getting medications. But the problem is the medications, they're, trying to treat a condition that's chronic, and it's a progressively degenerative condition, that's how the current medical view is of it here, that is only going to get worse. And they can just keep giving you medications, which only are covering up the symptoms. They don't have a treatment to help correct neuropathy. A lot of it gets down to diet and nutrition, which that is another factor that we look at in the office. We'll have some questionnaires, and if needed, we'll even get into lab tests, or even get your previous lab tests that you've maybe had done in a medical facility, so that we can look at them more from a functional medicine standpoint. And if there are deficiencies there, we can make sure that we help, get that supplemented, whether that be through changing your diet or literally getting you nutritional supplements to help reverse that deficiency. So, coming into that seminar, we're going to touch on a lot of these things here. A lot of people, have, they've maybe had to have an amputation. They've maybe already started to get, skin lesions, where they've had that decreased circulation. Now they're getting ulcerations, and hopefully it's not getting infected. That stuff is needing to get further treatment until, we don't even work with some of those patients. We'll start to help them a little bit by using some of the therapies in office, but that has to be kind of co-managed until we get that infection taken care of, from an outside source. And we've had enough of those patients in the office that, some of them, once they get that corrected, we can then start working with them. So, after you've gone through the in-office workshop, we can get all your questions answered there. What we have then is literally getting, your like an initial consultation and screening test done if you wish. If you already know that you have neuropathy going on and you just want to get started, then we can take you through the full evaluation process. So I'm going to rewind a little bit here. We're going to go back to what is in that initial, consultation and screening test. Well, that's where, if you came into the workshop, you will be filling out the paperwork there, so we can kind of get a general idea of where you're at. And during that assessment, we'll be reviewing all that stuff with you. We'll see if there's other things that are needed. A lot of times, again, like I said before, it can get down to some diet and nutrition things that we need to deal with. And if that's the case, we will review that with you there. And we'll get into then the evaluation process. So we'll do that quantitative sensory testing, where we're going to test a bunch of different things to see how well your body can sense and feel them. And that'll give us an idea of what kind of percent sensory loss that you have. And from there, we can give you a better idea of just how long it's probably going to take to get the neuropathy reversed. And again, we'll give you an idea of, what kind of an investment it might take to get the neuropathy reversed. And, if there is any, contributions that your insurance company might have for it. So once, you've kind of gone through that process, we can have that stuff all outlined. You get to make the decision if you want to move forward or not. If you do, and you're going to start care, then we will go through the rest of the evaluation there. We have, some hospital grade ANS testing, or autonomic nervous system testing equipment, where the main test that we use is a pseudomotor test, so we can find out various different things. How well are basically the nerves functioning that go to your hands and your feet. They're going to get a little bit of stimulation to see if your sweat glands are working properly there. It also give us, bioimpedance analysis. So we're going to see how well is your body hydrated, your body composition and all that, so that long term we can have those measurements and see how you are progressing through care. We'll also use these tests as you go through treatment. If you're getting treatment done in office, and we'll go through those treatments here shortly, we're going to literally be evaluating you on a monthly basis to make sure that everything is headed in the right direction. So that'd be that quantitative sensory testing, the motor testing, and if people are needed on that initial evaluation and it looks like you might have possibly some spinal degeneration, or there's maybe some stenosis going on. We're also going to want to rule out that because we don't want to miss anything here. And, the treatments that we're going to move forward with may include chiropractic care. I've seen some treatment places where there is no magic chiropractic adjustment that is going to make neuropathy go away in and of itself. You need to have all these other components because neuropathy is a multifaceted disease, and different people have different things affecting and causing the neuropathy in them. So could be from diabetes, could be from chemotherapy, could be from alcoholism, could be from malnutrition, malabsorption. So then you don't have certain vitamins and minerals affecting you. Could be from autoimmune diseases. There's dozens of different causes of neuropathy. Exposure to heavy metals, pesticides, herbicides, different chemicals in the environment here that could be causing toxic issues. And again, that's where labs will help us determine if that's what's going on. And we can help basically get that stuff cleared out of your system, whether that be through some things that we can do diet and nutrition wise, or if we have to send you out to get chelation therapy done to help clear that stuff out of your system. So after we've had the full evaluation there, and once you start treatment, in-office treatments in our office consist of a class 4 laser. It's a K laser. It's a 100-watt laser. It's the most powerful laser that you can use in an office right now. And it helps to restore the circulation. So it helps get that blood flow back so we can start to get those nerves to heal back up again. So it'll even help regrow blood vessels especially again in the hands and the feet. And it'll help keep that inflammation down, and it'll help the nerves even regrow. Besides that, then we're also going to use a focused shockwave therapy that ends up helping to even break up any scar tissue. So a lot of people will notice a big, big difference right away once we start using that focused shockwave, because it actually helps to, again, decrease inflammation, decrease pain, and help to even stimulate your body's own stem cells that help to regrow connective tissue. So again, using it in your hands and your feet, it can be a tremendous boost right away when we start to use that, typically in the first 90 days of treatment. So besides that, we also use PEMF therapy, or pulsed electromagnetic field therapy. That we run it at different frequencies, typically right away. It's a detox type frequency to help clear things out of your system. And then after a while, it's more to help stimulate the nerves so that they're vibrating at the proper frequency. PEMF therapy was originally developed to help heal diabetic ulcers. The class 4 laser was originally cleared to help deal with a mononeuropathy, carpal tunnel syndrome. So we are using this in the best sense to help reverse your neuropathy. Again, we get 60 to 100% reversal in most of our patients. So next, there's in-home therapies that people can be doing. We use an anodyne, and that has one of the frequencies that our laser uses. Our laser actually uses 5 different frequencies. I guess let me roll back to the laser a little bit here. We're a part of the Laser Therapy Institute, and we have all of their custom laser settings to help reverse neuropathy, and it's worked rather well on all of our patients. We literally can see a significant difference in the first few weeks of treatment with people, and ongoing. I don't think you're going to find anything better than the therapy that we have from the Laser Therapy Institute. Moving on to the home therapy here, the anodyne is a light therapy. It's like I say, it's got one of the frequencies that actually helps to stimulate increased blood flow, and you'll be placing these on your lower leg and foot to help improve that circulation there. These therapies last for a half an hour, and you'll be doing that on each leg. So it takes about an hour to run the therapies at a time. You're going to be doing that morning and evening at home. And this just helps to complement the therapies that we're doing in the office. The nice part about having that, you're going to own that item and you can use it for the rest of your life. It's heavy duty. It's not going to get destroyed. You might need to replace the pads after a while if you're using it on a regular basis. But for that first 90 days, you're going to be using it twice a day to help reverse the neuropathy. The other thing is there's going to be an electric stim unit. It's not a TENS unit. It's a unit that is very similar to our PEMF therapy in the office. It's run at a frequency that helps to normalize the nerves and get them to function properly again. But again, this is something you have at home. You can run it at the same time, usually on the opposite leg or arm and hand, as what you're running the anodyne on. So by running these, again, now we're stimulating the nerves. We're also stimulating the blood flow. We're getting this healing up and starting to function normally again. But it's also done in combination with some nutrition. Again, we kind of talked about the nitric oxide and its supplements to help boost your nitric oxide and also decrease inflammation in your body. We'll give you an anti-inflammatory diet that you can eat, so you're not eating foods that are causing inflammation and just further, degrading your neuropathy and causing it to get worse. As people do this, and a lot of people, when they're filling out their initial paperwork, there's other things that we might have to deal with, and it gets into gut health and systemic inflammation. If that's the case, then we'll get you, on a gut health program that's going to help decrease systemic inflammation. And all of the patients that we put on that, I would say, is a side effect of it, because you're going to be eating that anti-inflammatory diet. You'll basically get the supplements that are going to help repair and heal your gut. I won't get into that in detail here right now, but it's going to basically help you lose weight. I mean, and what I've seen with everybody that's been on it so far, they'll lose 3 to 7 pounds a week just because you're getting rid of that inflammation in your body and you're eating healthier. So on top of that, we have an at-home online program where it's going to help you understand exactly, what you should be eating. It's going to help you, log when you're doing your therapies. It's going to tell you when you should be taking your supplements, what food you should be eating and all that. It has diet and recipe issues or diet recommendations and recipes that you can use to cook things and give you just different ideas of foods that you might not even think of to make. So, and they're all going to be healthy and help just decrease that inflammation. As well as inside of that program, you can actually contact us. So you'll be in contact with us, 24/7. You can send a message to us. And if you have questions on anything, we can answer those questions for you then. You can even set up telehealth visits through that as well. So, if you do want to sit down with us, you live a further distance away, we can make sure that we're available for you. And, you can set up that time. And again, we can answer questions then or go over labs or exercises, food or different recipes, whatever the questions happen to be. So the nice part is, if you do live a distance away, you can literally just do the in-home and diet and nutrition things. If you just can't quite get into the office, because typically the patients that are going to be coming into the office are going to have to be coming in twice a week for this first 90 days. And again, we'll be reassessing you to see where you are along the way. And depending on the severity of the condition, that's just the start of it here. A lot of the mild conditions are probably taking around about 6 months, 3 to 6 months to kind of get reversed. People who are in moderate are probably anywhere from that 6 months out to a year. But then we get into the severe ones, and we're literally looking probably, literally in the year to 2 year range to help reverse that neuropathy. So just so you got an idea here of what you're really looking at here in, the commitment, because you're going to have to be investing in yourself here to help reverse this neuropathy, because everybody wants to avoid, what it would turn into if you don't. Nobody wants to get those ulcers and get it infected and possibly have to look at, having an amputation. So let's get you in, let's get you evaluated here and just determine how bad is your neuropathy here? Do you even have neuropathy going on at all? We have some patients that have come in and, we get them tested and they don't have neuropathy going on at all. It's actually probably more chiropractic problem, where it's a sciatica. They actually have a nerve root issue, and that gets into a completely different treatment protocol then that we have to put you through. But that's what our holistic health assessment is for. It's to determine, if we, one, can reverse your neuropathy, but it also gives us a better idea if there's other things going on that, if that's the case, hey, we don't want to have you go through a treatment protocol that really isn't going to work for you here. We want to get you on the correct one that's going to get you the best results and lasting results at that as well. So I guess if you have any questions or anything like that, you want to come in and attend one of our free workshops, you can contact the office at 701-356-0016. Or an easy way to get to it is on our website. Here's a short link. It's just fargopn.com. So FARGOPN.com. And that'll take you right to our neuropathy page where you can just send in a form, and our receptionist will reach out to you and get you scheduled for that workshop. You can also even just schedule an initial consultation if that's what you want to do. So don't let it go too long. Let's get this evaluated. We'd like to make sure that we get you screened and make sure that if you do have neuropathy, we're dealing with it more on that mild end of the spectrum and not waiting till it's way out on that extreme end of the spectrum. We do have patients that come in on the extreme end, and some of them we can help, some of them we can't. But the sooner you get in, the better chances that you're going to have that we can help you reverse your neuropathy so that you can finally feel good and live your full potential. Have a great day, and we will talk to you again